Personal injuries are very important. They have striking issues that affect the whole body dynamics, such as an ankle injury. An ankle issue will affect a knee, will affect the hip, will affect a low back, will affect the mid back, will affect the neck. And people just don't get it when I'm saying people, insurance carriers, how a person who fell off of a ladder and landed on a bum and hurt their low back now has shoulder issues, 6 months, a year later.
Or headaches.
Exactly.
Headaches. I mean, they're dealing with issues with chronic headaches, with dizziness, and the conversation that you and I always have on a secondary level is like, oh, this is not contributed to the injury. Okay, so they fell down, and somehow their whole body fell down, but there's only one injury. And that's like the low back, and that's it. Like none of the body, and this is what's so intriguing. I laugh about it. I just go, you know what? What color is the red bus? Right. I don't know. It's pink today because we have more pink. No, you cannot have a whole body engaged in a traumatic acceleration, deceleration injury or an impact, and someone can tell us or a patient that, by the way, the only part that you have injured is your low back or your neck, and that's it. And
you were mentioning right there when acceleration, deceleration, that those are terms that are used primarily for describing someone coming from a high velocity to a sudden stop, and it's a very common physics term and a very popular one in the legal realm. And I'm glad that you used it, because the thing that we're talking today is about motor vehicle accidents, and specifically auto accidents that cause injuries and leave people with problems many, many, many months later. I know you know this, and from the time that I began my practice, the most common thing after a motor vehicle accident was someone that said, I don't have anything that hurts, right?
Absolutely.
And then how long does it take before the symptoms show up, Mario?
Come on. Realistically, Alex, I would say anywhere between 3 to 4 weeks, sometimes even longer. I have patients that actually refuse treatment, and they tell me this. Like I had I was hit by a car from the back. That's like real common.
Right.
People nowadays are, they pay more attention to their cell phones than what's in front of them, or anywhere, distractions, right? So for whatever reason, you get hit from the back. I mean, that incident I hear so many times. Patients come in, they're dealing with headaches, migraines, severe migraines, where they're on heavy medications. They have neck issues, chronic, and they tell me, I've never been the same. And it started 2 years ago when this happened. Well, what that event was, I got hit from the back.
Yeah.
And then they even tell me, I've never been the same again.
You've been damaged.
You know what? And they refuse, and I tell them, well, did you get any care? No, I didn't get any care because I was fine. I felt fine, and, I didn't need it.
Patients need to get evaluated after an auto accident. They do, because you never know what's going on. And sometimes the body has amazing capacities of hiding symptoms. Literally, you can have a person who comes in your office that hurts his low back and says, I only have pain in my back, in my low back. Then after a little quick assessment, we just kind of move the neck, and he goes, ow, that my neck hurts. Right. And I go, well, did it hurt before? And I go, no. And it's not that I'm stimulating. It's that the pain in the low back camouflages other areas. It's like almost like you get hit by a hammer, and all of a sudden on your toe, you suddenly don't have back pain.
That's exactly it.
The brain has the ability to kind of manipulate the symptoms, and then later, 2 days later, 2 weeks later, after the carrier has called you and said, are you okay? Then you start having a presentation of symptoms. And, you say, well, I didn't have anything on that day. You didn't want to get checked out. And all suddenly you have symptoms that you didn't know about. This happens more often and more commonly when you get older. As people get older, they have these symptoms present. We've done studies. We can actually show NCBI studies where people have issues years later from a soft tissue cervical injury that lead to chronic headaches, migraines, mental disorders as a result of poor sleep. Just chronic pain is horrible when it actually affects individuals. Therefore, it's very important, and our goal today was to have kind of an open forum of should you get care, and should you get evaluated, and what kind of treatment options do we have? I mean, we'll have tons